Hi, everybody. Welcome to the podcast Redesigning Normal. I'm your host, Andrew Southern, and today I'm joined by Alex Balan, Regional Operations Manager at CORA Physical Therapy in Naples, Florida. Thank you for joining me.
Thank you for having me.
So, Alex, I want to just kind of jump right into it. I think most of my guests on this podcast sort of started thinking about or hearing about COVID in February or March of 2020. Is that kind of about the same case for you?
Yeah, I'd say about February we were starting to think about, where is this thing heading and what's going to happen.
So what happened in your business when things really kind of got serious, early to mid-March probably?
Okay. I oversee all the clinics in Southwest Florida, basically from Naples to Sarasota.
Okay.
This region wasn't affected as much as other regions in the company. However, at first there was a lot of uncertainty. So there was, anybody with a cold, maybe, we were thinking worst case scenario.
Sure.
So we did initially take a hit in terms of patients canceling. And we had to transition quickly to other platforms, whether it be telehealth, whether it be providing therapy at people's homes, and all the while trying to take care of our staff and trying to take care of the patients.
Sure.
We implemented CDC guidelines pretty much immediately, and we continue to follow CDC guidelines. So patients who were coming in the clinic, we spread out all the equipment, we spread out the tables. Each patient that would come in, still to this day, they have their temperature checked, they fill out a form, COVID questionnaire. All of the employees had their temperatures checked. Everyone wore masks. And then for those patients who were hesitant to come into the clinic, we did rapidly scale up our telehealth platform.
Okay.
And to date, company-wide, we've done over 40,000 telehealth visits.
Wow. Let me back up because I should have asked this earlier. Tell me a little bit about CORA and the breadth of the practice. How many locations, that kind of thing.
CORA is a big outpatient physical therapy provider. We are the largest in Florida.
Okay.
We just added another 11 clinics. So we have, 236 clinics across 11 states.
Wow.
So that was something else that we had to kind of juggle when COVID hit, because each states had their own laws pertaining to, or their own regulations pertaining to COVID. For example, I believe it was Kentucky didn't see physical therapy as an essential business. So those clinics had to close.
Right.
I believe that was the only state where that occurred, but that was just one regulation that we had to deal with.
Are you in touch? I mean, I imagine that you speak with the other regional operations managers for the other regions within CORA, and
on occasion, yep.
Like, were you guys trying to coordinate, or was it really just like, okay, my state says this, your states say this kind of thing? What was that? What did that look like? How did you make those decisions collectively?
Those decisions basically came down from corporate. Okay. We have our safety director. She probably needs like a 3-month vacation coming up soon because it was constant. Like I said, from the very beginning, we followed CDC guidelines,
Sure.
But those CDC guidelines, especially at first, were changing rapidly.
Yeah.
So we had to change rapidly. We had to develop ways to send out information to all of the clinics on a daily basis, which we did with our morning emails.
Right.
Just updating all the new regulations and whatnot. As regional managers and senior leadership, we started having, town hall conference calls,
Sure.
just to see how everyone was doing, how we were coping, to bounce ideas off of each other. And to be honest, I was very impressed at how quickly we were able to change on a daily basis almost. And survive, and not only survive, but we, considering all things considered, we prospered during that time.
Really? So I mean, out of more than 200 locations, practice wide, that probably equates to a lot of patients a day.
Yes.
right? And then during that time, as you said, I guess maybe early on, folks are canceling, but their physical therapy needs, I imagine, remain.
Correct.
Right. So they as soon as they can, they really need to get back in order to continue their recovery or whatever it is that they're working on. Right. So
Correct.
it is very much essential, I imagine, just as other medical, practices are essential.
It is. And I mean, if you just had a total knee replacement 2 weeks ago, if you don't have therapy after that, then
Right.
you're going to be in rough shape. If you
Right.
had a
Right.
stroke, if you had, I mean, if you're generally deconditioned, we were an essential business that people really, really needed our help. So we had
Sure.
to figure out ways to deliver our services to these patients.
And then the guidance is changing all the time. And as you said, you were impressed with how quickly the organization was able to ingest those, new recommendations and then implement whatever changes that you needed to make at the actual location level, right?
Correct.
Which I imagine could be, okay, now we're going to be wearing face masks. That was the quick one, right? Like we all got to wear face masks and all the customers or all the patients have to wear face masks as well.
Correct.
Right. And then it's like, I don't know, did they ever do, in your region, did they ever do, okay, you have to do temperature checks, or is that something that you guys decided to do as a practice?
And I don't know if it was recommended CDC guidelines. I know it wasn't a law or
Right.
regulation provided by the government, but us as a company, we decided almost immediately that everyone needed to have a temperature check.
Got it. Got it. All right. Let me step back a little bit. Alex, how did you get into this business?
Wow. To be honest with you, I come from a long line of engineers. So I
Okay.
wanted to study aerospace engineering, and I was already accepted into Rutgers University. I was still in high school, but I was accepted into Rutgers University for engineering. And I hurt my shoulder playing baseball in high school,
Mm-hmm.
so I needed physical therapy. And that's the first I had ever heard of physical therapy.
Like senior year playing ball,
Yep.
and you hurt your shoulder.
Yeah. And I
Okay.
said, wow, this is a lot of fun. And I said, but I thought, well, I'm already accepted into engineering or whatnot. So
Right.
I went to my freshman year of college, and then I had to start taking calculus and statics and dynamics and calculus two. And I'm like, this is not for me.
Are you from Florida?
I'm from New Jersey originally.
Oh, okay, okay. So I was gonna say, like, if you weren't used to New Brunswick winters, that would also probably
No,
seal the
yes.
deal.
No, I was born and raised, so I'm used to it.
All right, cool. So now you've migrated south, where it's a little bit more temperate, right?
Yes, I moved down to Florida in 2000.
I'm sort of, it's funny because I'm sort of like an airplane nerd as well. So I'm super into this idea of aerospace engineering.
Yeah,
But I can that is super interesting that this other thing became, for you more interesting, right?
it did. And honestly, as soon as I switched over to physical therapy, even though I wasn't in the program yet, immediately you're taking anatomy and physiology classes and stuff, and things of that nature. And to me anyway, it seemed like, okay, I'm doing what I want to do,
Sure.
as opposed to all these calculus problems that didn't make sense to me.
There's something, I mean, you can speak to this much, much more clearly than I could, that in a way, the human body is like an extremely well engineered machine, which can heal itself and do all these things that, you just, modern engineering is nowhere near, being able to design something like that. So I can imagine for your engineer's brain is also kind of interested in the way that the pieces all fit together and work.
It's really, the human body is really unbelievable. I mean, so many examples in my career that I've seen of people that come back from very, very serious injuries, and they make 90, 95, 100% recovery, and it's unbelievable to me.
And so you went into physical therapy practice
Hmm.
after school and did that for a while and then became in your current role. Like how did you get to that place?
So I worked for a few years in New Jersey,
Mm-hmm.
and then moved to Miami. Again, worked for a few years there, and then when I moved to Naples, I ended up opening my own PT company, and then we opened a second clinic. So we had two clinics, and then when my wife and I decided it was time to sell, We had both worked for Quora way back in the past, so we reached out to Quora and everything worked out. So we ended up selling to Quora, and
Got it.
that's how I'm here now.
Is that how the practice grows? Like you had mentioned, there's 11 new locations. They acquire someone else's practice.
Not always.
Okay.
It could be one of two, either an acquisition or what we call a de novo clinic, which we just build.
Okay.
Typically, when we're coming into a new territory, a new market, ideally we want to be able to acquire clinics because
Sure.
they've been there for a while. They have all the referral sources and the and the ties in the community, and then we could start building de novo clinics around that.
Got it. Have you been involved in building sort of new construction clinics before?
Yeah, three, I believe. Yeah, three
So
so far in my region.
if you're doing that, I imagine it's okay. We find a location, we take a lease, right? You're taking a existing space, I imagine,
Hmm.
and then building it out the way that is consistent with sort of best practices for physical therapy facilities. Is that
Yep.
kind of the basics?
Yeah, exactly.
Um, and what does that look like? Just for the audience's sake, like what does a physical therapy facility look like in a typical market?
Our typical model is pretty much an open space.
Hmm.
Um, and it almost looks like it kind of has that fitness center environment to it. That way we could all, I've always said that patients come to us because for the most part they're in pain and they have to come 2 or 3 times a week for sometimes 3 months.
Hmm.
So if on top of that the facility is kind of ho hum and we're not having fun, then nobody's going to really want to come to therapy.
Sure.
So we have that type of environment at all of our clinics. It is kind of an open space. We have top of the line equipment, but that allows us to be able to talk to all of our patients. The patients can talk to each other, and it's not the secluded environment that some other clinics may have, where they have individual treatment rooms and whatnot.
Got it. Got it. And that would be what, a couple thousand square feet or many thousand square feet?
It's usually somewhere between 2,500 to 3,000.
Wow. Okay, cool. I'm trying to think through the process. So if I have a an injury, I run actually, Alex. I run. So sometimes my knees hurt after I run, probably because I don't stretch well, right? But
Perhaps.
I would come to your clinic, or I would call you ahead of time, and I'd say, listen, I need some help with my knees because I want to keep running, and that would be a perfectly reasonable call to make, right? You guys would take me in and show me some exercises to do. Like, is that about right?
Absolutely. And in the state of Florida, we're able to see patients with direct access up to 30 days. So you wouldn't need a
A
physician's
refer-
prescription.
Got it. So I can just
Um,
show up and then bill my insurance for it, or you
correct.
bill my
And you
insurance for it.
and you would receive a full evaluation by a physical therapist. Most all physical therapists now, within the last 5 or 6 years, they're all doctors of physical therapy.
Okay.
So you would receive a full evaluation. We'd be able to figure out exactly why your knee is hurting,
Hmm.
and develop a plan of care, a treatment plan from there.
Do you have like imaging machines for this kind of stuff when people come in, or is it touch, or how do you do it?
We do not. Our evaluations are based on manual evaluations
Okay.
and the subjective comments that the patient provides us.
Got it.
That is something that the American Physical Therapy Association is pushing for more now that it's a doctorate program for
Hmm.
physical therapists. They want more autonomy that the PT can order an X-ray or an MRI or whatnot. That being
Right.
said, I mean, PTs are experts at evaluating and finding out what a problem is without imaging, which at the end of the day saves healthcare insurance providers or the patient a ton of money.
Because the other option is to go to a sports medicine facility and go through all the imaging on that side.
Well, you could, I mean, I'll take you as an example. You could go to your primary physician and tell them,
Uh huh.
listen, my knees are bothering me when I run. Now, that primary physician may want to send you out for imaging. and then might refer you to physical therapy, or he may send you to an orthopedist.
Okay.
So honestly, at the end of the day, if once PTs have more autonomy, that will also save millions of dollars each year because you're avoiding all of that.
Right. And I guess the basis is lower.
Correct.
Okay. Got it. All right. Well, let me get back into COVID for a second. So as this COVID has continued through the summer, right? The summer of 2020, what happened with your business? I think you mentioned that you were able to sort of thrive at some point. What happened?
I wouldn't say, I mean, compared to the year before, we didn't thrive, but
Sure,
all
of
things
course.
considered, as you know, some other companies took a big hit, and we were
Okay.
able to manage it and manage it well. Again, going back to my region, honestly, we were not very bad.
Okay.
Again, though, we did offer the telehealth platform. We did go treat patients at their homes. So we took, all the tools that we had available,
Right.
and we ran with it, and we were able to keep everyone open. All the clinics stayed open.
Wow.
And honestly, when you have a challenge like that,
Mm-hmm.
you see the real personalities come out.
Sure.
And I don't know how many times I heard, Alex, is it okay if I leave early? That way, John Smith can get a few more hours because he had to leave early yesterday. Since we had, our volume did decrease.
Right.
So we kind of had to balance that. I wanted to give everyone as many hours as I could, but we also had to be efficient.
Right.
So, I mean, people would just offer themselves. I'm gonna leave early today. That way, John Smith can stay later, and then Jane Doe can stay later the next day.
Got it. Got it. So I think you mentioned in the facilities you were doing temperature screening, and people have to fill out a form that says I haven't had a fever or something like that. Did you end up doing air filtration and stuff like that in the main spaces?
We did not. We did have a couple clinics where there was a positive COVID case.
Mm-hmm.
If it was something that was close to when the patient was there, then we'd had our cleaning team come in and do a complete disinfecting of the clinic with a virus bomb or whatever they called it and all that.
Right. Right.
But we didn't do anything to the filtration.
I would imagine that your facilities were already being, cleaned all the time, right? So,
Well, yes. I mean, if a patient's on a treatment table, when that table's open, it gets wiped down. If they use
right.
a piece of equipment, they wipe it down. Another thing that we did add, though, just for peace of mind and for it to be easier for us to keep track of what has been cleaned, because there's a lot of pieces of equipment in there, what has been cleaned and what has not been cleaned, is that we put up little signs that said clean, dirty.
Right.
So if someone was on the stationary bike, that was flipped over to dirty until someone could get over there, wipe it all down, and then flip it back over to clean. Same thing with the tables and everything else.
Got it. And then as you move through the winter of 2020 and then into 2021, what did you find? Things were just, you said where you were is maybe not so locked down, certainly not as locked down as, let's say, a place in California or
Correct.
a place in the Northeast.
Correct.
I'm sure you've still got friends or family in the Northeast somewhere that were telling you like, oh my goodness, this is
They couldn't wait to come down to Florida.
Yeah, exactly. There are a lot of people that would go down there and be like, this is amazing. This is completely different.
Yeah.
So what was happening? It was just loosening like more and more and hopefully getting a little bit more back to normal. I think up here, because I'm in New Jersey right now, it's feeling a little bit back to normal just now.
Wow. One thing that I did notice, Southwest Florida is very seasonal in terms of you get a bunch of snowbirds that come down November through April or so. They tended to come down a little bit later this season.
Okay.
We also have a lot of Canadians and Europeans that come here and they'll stay for 3 months each year.
Sure.
That didn't happen.
Okay.
So we did notice that. But aside from that, this year has been pretty much back to normal.
For all of 2021.
Yeah.
Yeah, I think actually, just based on what you're saying, I think I've done a bunch of these podcasts, and this might be one of the more like low touch, like the sort of how should I say this? It sounds as though you were affected probably one of the least of the folks that I've spoken to, which is a great thing. I mean, I wish that everybody had that experience where it was like a concern and we had to do some stuff to manage it, but fundamentally it didn't maybe change things as great as it did in New York, for instance.
True. And again, though, this is my region.
Okay.
The East Coast of Miami, Fort Lauderdale, that whole area, they took a big hit.
Okay.
Big hit.
Got it. So the West Coast, the Southwest Coast, it was a lot more.
Correct.
Less.
Right. And it seemed like the bigger metropolitan areas are what took the bigger hits.
Got it.
Yeah.
Okay. So what things do you think you've learned as a practice from COVID, from the challenges of COVID? I think you mentioned that you guys did a good job communicating with each other. What are some other lessons learned?
Well, I always say that if something can come about from a big challenge, then even though, in a business aspect, even though we didn't do as well as we normally would have if that challenge wasn't there, but if you could take something away from that in order to add to the business and continue the business, on a growth path, mm-hmm. then that's what you take away from it. And that's the success that you pull from it. So I would say definitely our telehealth platform is one. Obviously, we're not going to be doing 40,000 telehealth visits on a normal, regular basis.
Sure.
But in my career, I don't know how many times I've heard, I just can't come in from 8 to 6 because I work those hours, or I had to take care of my baby, or I had to take care of my parents, or whatever. Now we have something for those patients. Now we have something to offer for those patients.
Sure.
And I think, making sure that those clean, dirty signs and everything is always being wiped down consistently. I don't think that's ever going to change. And also another thing that I didn't mention before, we also opened up an online store for patients to be able to purchase their home exercise equipment at very reasonable rates.
Sure.
And not to mention, we also have a lot of that equipment for sale at the clinics. So, those are things that, if we take away from it and we continue to develop them, those are things that were not at the forefront prior to COVID.
Got it. And this accelerated that telehealth.
Exactly.
What I guess I would call it sort of like online retail of
right.
actual equipment, right? So if I come to you and I'm unable to come during normal business hours because I work, you could say to me, no problem. You can purchase this thing. We're going to drop ship you this, this equipment that you're going to need. And then you can get on the phone with one of our folks after hours on a telehealth visit.
Yep.
And that's a patient that you just didn't have before.
Exactly. And we could even combine it. Let's say, all right, I know it's difficult for you to come in. Let's come in for your initial evaluation and come in once a month, and then the rest we'll do through telehealth.
Yeah, that hybrid makes a lot of sense because you do want to probably see the person and touch and understand what's going on in person. And then once you get a good sense of it, you can do some of these things as telehealth, maybe come in again after a little while and check up on them.
Right. So, and see how they're progressing.
That's interesting. Like those parts of your business have accelerated during COVID out of necessity, but probably aren't going to go away.
Exactly. And we had a telehealth platform already, but we had to make, and this kind of threw our feet into the fire. We had to make changes and develop it. And we actually changed platforms in the middle of COVID.
Oh, wow. Okay.
Yeah. So we have a whole telehealth team now. Our plan is to expand it and through all the states that we cover, and beyond.
Amazing. Is that like if I become a customer of yours that I go to your site, I log in, and then it can launch the telehealth visit from there? Correct.
Yeah. Cool. They have a link to log on to, and then that's it.
This reminds me a lot of a conversation that I had with a man that was doing has a restaurant. And during COVID, he was forced to close the restaurant, the actual dining room. So he built up the takeout portion, which was not that strong. He did some takeout, but now
Yeah.
suddenly he was doing a ton of takeout. So when it reopened, when the dining room reopened, the takeout continued. So so he came out of it, stronger because
Yes.
now he had two sources of
Income streams.
servicing income streams and servicing the customer.
Yeah.
Right, the folks that didn't really necessarily want to go dine in, but they wanted that food. Now they can get it, from their takeout window. They made a whole section for takeout. Amazing.
Exactly. And that speaks to the comment that I made a little while ago. If you could take something from that crisis,
Right.
and build upon it,
Sure. So what's the future of your business now that you've got these things in place? Is there something else you're looking towards, or that the group is looking towards, to even better service the customers?
Well, our plans are to continue to expand. We have rapid growth ahead. We plan to double or triple in size within the next several years.
Wow.
Yeah. We just purchased an additional, I think, 11 clinics in Wisconsin. So we just entered the Wisconsin market.
Is it difficult from a regulatory perspective to light up new states? I mean, I imagine each state has different rules and regulations, but maybe physical therapy doesn't have to abide by such stringent rules as maybe full-blown medical practices. I don't know. I'm just wondering.
I haven't been a part of that, but
Okay.
I would imagine. But I mean, our executive leadership staff and our senior leadership staff, they are all well versed in it.
Sure.
And again, when we go into a new market, ideally we do an acquisition. So we get a lot of feedback from the company that we're acquiring.
Of course. Yeah.
On those type of issues.
Right. That makes a lot more sense than just showing up one day in a state and taking a lease and saying,
Right.
not that there wouldn't be research, but it's a lot easier, frankly.
Exactly.
It's a gentler lift to acquire someone else's facility and everything that they know and all of their customer base.
Yeah, and the different insurance plans.
Got it.
Even when I sold to Quora, there was a lot of discussion. I was educating them on the different local insurance plans in Collier County.
Right.
So, and that's just a little county. Imagine
Yep.
a whole state. So, I'm sure they get a lot of feedback from the previous owners.
And there's a competitive advantage because you've just, instead of competing with the existing group, you have
Right.
acquired the existing group.
Exactly.
Got it. Well, Alex, I really appreciate it. Thank you so much for taking your time today to have this discussion. I think it was great.
I think it was a great discussion as well. I appreciate you having me on.
Thanks, Alex. Have a good day.
Thank you. You too.